Evening, everyone. Thank you for joining us. I want to just talk about a few things. One, just what today looked like, what we see going forward. So I will tell you, today for me, very sad day. As I was coming to work, I drove up past a few of our schools, and I could see children that I could tell families were for the first time knowing that classes were canceled because maybe they had worked the third shift all night. We didn't get results from the vote till after 11, and children being turned away because classes were canceled, and frankly, children crying. It was just a sad day. This whole all day today, working with our team to really put a plan together to really talk about what's best to go forward. Right on Monday, we had 82% of our teachers that reported for work. And there was a struggle because we had to get quite a few substitutes. Tuesday, that grew better to 84%. We had over 200,000 of our children present on Monday, but we saw that number rising quite a bit even as we got into Tuesday. Today, of course, no children in classrooms. 10% of our 21,600 teachers coming to our school buildings, and a similar percentage of our substitutes coming to our school buildings. And I want to be really clear about what has happened. So after 11 o'clock at night, even though initially the vote was supposed to be at 9, we got notified that 73% of teachers voted for a walkout. It was an illegal strike. Let's be really clear. Under state law, so even though the discussion is it's a walkout to go remote, under state law, we are not authorized to go remote as a district. We are not authorized. The conversation as we were looking at our plans today, we brought all of our principals together. I met with over 500 principals today, having a conversation to make it clear for them and for our staff that any remote instruction that we would do would have to be used using our emergency days that are used because we might have a blizzard, because we have some other emergency that could happen at a school level. It would be us using up all of our emergency days to the point that once we run out, we would not be able to, we'd have to make up any instructional days. As we thought about what was the plan forward, the first step is, again, how do we best support our children? How do we make sure that we're doing right by our families? And as I was having conversations with our principals, what kept coming back over and over and over is, and this is our principals who are managing our schools every single day with our children, saying, CEO, we know that in-person instruction is where we need to be. We know that our schools are safe. Yes, do we have challenges across individual schools? Absolutely. Do we respond? Absolutely. Ladies and gentlemen, let me talk for a second about Park Manor. Prior to the break, we were transitioning, we the district, not anybody else, we were transitioning classrooms to remote because we started seeing cases, potentially first signs of Omicron. We were aggressive. Immediately that got turned to, this is an unsafe school. So much that come back Monday after break, 20 out of 21 teachers did not show up for work and said, we're just going to work from home. We're going to be remote. And I got to give credit where credit's due. So out of 250 children, 230 did not show up. The largest class I had at Park Manor was 5 children in kindergarten. I mean, think about the orchestration to be able to do that, right? To have that many adults out, that many children. And think about all the effort and energy. And of course, we know there was a press event that morning. Imagine if that kind of power was used to help our children get vaccinated. Imagine if that kind of power was used for us to leverage our resources of this amazing city to help our families be safer. I mean, imagine what we could do. Are there concerns? Absolutely. So, first of all, I want to be very clear. Right now, as I'm looking at what's happening with our staff, where they're being discouraged from coming to our buildings, we have no choice but to cancel classes tomorrow. We've already sent another notice to families. As I had a conversation with our principals and said, what is the best path forward? What they came back to me and said, CEO, we got to continue to be the champions to advocate for in-person instruction. We know that is the right thing to do. And so we cannot give up that. In fact, here's what they asked of me. They said, allow us as early as Friday, because in some schools they said, our staff are ready to receive children again. They are ready. They know that it's gonna create a lot of stress for them with their union, but they're ready. Let us do it. Other schools said, let us do it gradually. Whether it's helping children with doing packets that they can pick up for home, whether it's tutoring, whether it's enrichment, whether it's counseling for our high school students that they're right now going still through the college process. Let us do it. Don't hold us back. And we talked through a remote option. We talked through it, and we looked at every aspect of it. What would it take? How ready are we? What are the operational risks? Because, ladies and gentlemen, our goal is how do we best service families during this time? Because I'll tell you, I still cannot get over the circumstances that our families were put under, that they had no choice but to be put under, waiting until after 11 o'clock at night to know whether classes would be canceled because we didn't know whether we would have staff coming into our buildings. No choice at all. No real notice. And then the pressure comes back to the districts, like, you got to do this and you got to go remote. Again, by the way, staff not showing up to our buildings and being discouraged from coming to our buildings. And so the path forward that we see as the right path is, first of all, number one, we're not going to stop negotiating with the CTU. We had another negotiation today. We're not going to stop. We still believe that the right approach is not a district-wide hammer that does a brush across the entire schools, calling the schools unsafe, which there's no evidence to show that. And instead, making sure we address individual issues at school. Now, with that, though, we have some things that we agree on. Do we need more access to more testing? Absolutely. I have been very clear how frustrated I have been about not having enough testing in our schools. So that is something that we just have to ramp up. I've had a conversation today with Secretary Carmona. We've had conversations with the state. We'd have conversations at the federal level, and said we need to have a plan. Dr. Arwady and I, we're developing a plan. We're going to engage our nurses. With this surge, we have to expand testing. And so that is a plan that we are going to work on, especially as we're still negotiating with the CTU. We are committed to that. We've already bought KN95 masks for staff, for anybody who wants to use them. Those are already in the schools today. We also have an order now coming in for children, because again, if parents, if that's what will make them feel less anxious, we're going to have KN95 masks for children as well in our schools. Ladies and gentlemen, this is not about us trying to deny or trying to just create a fight about safety procedures. It's not about that. But when you start intimidating families, when you start intimidating staff, from the one thing that we know, which is that the safest place for children to be is in our schools, the best place for them. We know that what happened when we went remote last year. We know. And we're being asked, well, just do it for another week. Do it for another week. As if the implications for families were not serious. As if it was that easy to transition an entire district of over 330,000 students. To transition that easy. Why not? And that we're going to be able to do it with the quality that our students deserve, to compound the pressure that already families have because they were given so short notice. And so our approach forward is going to be, starting Friday, I welcome all my staff to come into the buildings. I welcome to come and join us to support our families, to support our children. And we will build plans as we support children, and again, allow schools starting as early as Friday to have children coming in for all services. And we'll continue gradually building up as we continue to have these conversations with CTU. With that, I will bring up the mayor. Thank you.
I will be brief in my remarks tonight. I think it's important that we reaffirm our value statement and our commitment to our parents and our students. That's why we're here. We're here to build an education system that wraps its arms around our young people and provides them with the opportunity for them to be successful for the rest of their lives, to be nurtured, mind, body, and soul every single day. That's what our education system is built on. That is the commitment that we have made to parents. And as I stand before you tonight, I have to ask myself again, why are we here in this moment? Why are we here again when we know that the safest place for our children is in school? Why are we here again when we know that our schools are safe? We have put over $100 million of resources into our schools over the last 2 years. Over $100 million in ventilation, in retrofitting classrooms, and making sure that we have masks, school safety teams. The list goes on and on. And why, when we've done that in partnership and at the behest of the CTU, are we here again today? Why are we here when you just heard CEO Martinez say that over the course of the last few months, when we've seen the surge in cases, the CPS has been nimble in adjusting at the school level, whether it's a class, whether it's a school itself, to keep those kids safe and go to remote if necessary, but only if necessary. I said this last night. In a time of crisis related to this pandemic, the worst possible thing that we can do is abandon the science, abandon the data. I've stood before you for 20 plus months since this pandemic first came to our shores. We're almost in sight of 2 years of dealing with this. Every single day that I've been before you to talk about COVID-19 and what we're doing, I have spoken the truth to you, even when it's been difficult, even when I've had to tell you and deliver bad news. Because we believe in the truth, we believe in the science, we believe in the data, and we believe in teaching you like the adults that you are, and giving you the information that you can use to help you protect yourself and your families. So if there was any reason for us to shut down an entire system and go fully remote, I would be the first one standing here and telling you that that was necessary. But I'm not saying that, nor is the CEO, nor is the public health expert, because it's not necessary. What we know from our own experience, from our data, from studies that have been done of our system over and over again, and other systems operating within the city of Chicago, across the country, and across the world, that the safest place for kids to be in the pandemic is in person in our schools. That has not changed. So if you care about our students, if you care about their families, as we do, we will not relent. Enough is enough. We are standing firm, and we are going to fight to get our kids back in in-person learning. Period. Full stop. We owe that to our children who suffered learning losses. I need you to report about the fact that 100,000 children were disconnected and disengaged when we were fully remote. 100,000 mostly black and brown and poor kids who weren't learning, and who we have to make up a lot of ground with them. And just when we're starting to do that, CTU pulls the rug right out from under them. Is that right? Is that fair? when the data and the science tell us that a different result should follow? It's not. And when will be the end of this if we capitulate and give in this time, as they're trying to force us unilaterally to do? There will be no end. No end in sight ever. We are willing to work with the CTU as we have been for 6 months, every week at the bargaining table. My challenge to them is come to the bargaining table every day, not for 3 hours as happened today. 3 hours. Come every day for 8, 10, 12 hours, 16 hours, 20 hours, whatever it takes, every single day. Because that is what was required. That's with a sense of urgency. That's what will respect our children and their families. Don't tell me you'll meet us tomorrow afternoon. Show up tomorrow morning, 8 a.m., and get a deal done. Don't tell me that you reject our deal and don't come back with any kind of a counter. That's not negotiating. I will not allow them to take our children hostage. I will not allow them to compromise the future of this generation of CPS students. That is not going to happen. I am grateful for all the outreach from parents, from teachers, from folks who just care about the health and well-being of our city that have come to me and my team personally today and telling us to stay strong, to hold the course, that we're in the right here. We know we are because we're on the side of our parents and our students. And as long as we're on the side of our parents and our students, we're always going to be in the right. We're always going to be in the right. We're going to listen to our parents. We're going to make sure their voices are at the table. We're going to listen to what the science and the data tell us. We're not going to abandon it. And we're not going to let anybody politicize this moment of crisis in our city. Omicron is real, and it is making people sick. But the thing that we need to do is hold firm to the science and the data that tells us over and over again that our schools are safe. Our schools are safe, no question about it. And there's nothing that anybody can tell us differently because we know it to be true. We know it from our own experience. We know it from the testing and the data that's gone forward. Our schools are safe, and that is the best place for our children to be. I'm not going to preside over a city or a school system that abandons our children. And going fully remote, and don't kid yourselves that it's going to be January 18th. They first told us it would just be today. And then at the last minute yesterday, they said January 18th, conveniently right after Martin Luther King Day. But do we have any guarantee from them that this arbitrary date that they picked will be the date? We don't. We don't. So the doors of our schoolhouse are open. We want our students and our teachers and our staff back on Friday. Anybody who does that will be paid. Anybody who shows up for our kids and honors their commitment and obligation, we will welcome them with open arms. That those who do not, we will not pay. We will not pay you for an unlawful, unilateral strike. We will not pay you to abandon your post and your children at a time when they and their families need us most. It will not happen on my watch. It will not happen. Come to the table in good faith. Come with proposals that make sense. And let me remind us, what are the two major sticking points? One, CTU wants to be able to shut down the entire district, and they want us to agree to a set of metrics that would do just that. We will not do that, because there's no basis to shut down an entire school district. You've heard it from Dr. Arwady. We've heard it from all the epidemiologists, all the tests that have been done. There's no basis to do that. We're not going to play that game. If there's a need for us to surgically shut down a classroom or a school, we're all about it. And we put a proposal on the table that I think honors our commitment and our obligation and reflects what we have been doing this entire school year. When there's a challenge, when there's a problem, we will pivot, and if we need to go to remote on a classroom by classroom basis or a school by school basis, we will do that. But we will do that based upon the data and the science, and we are not going to let anyone dictate to us anything different that doesn't comport with the data and the science. That's conflict one. Conflict two, testing. You heard me say this last night. Here's what the CTU wants us to agree to. They want us to agree to an opt-out system. What does that mean? It means that unless our parents affirmatively tell us that they don't want their kids tested, that we're going to be performing a quasi-medical procedure on children without their parents' knowledge or consent. Just ponder that for a moment. As a parent of a child, I would be outraged if a school system was doing anything with my child that I didn't know about and I didn't affirmatively authorize. Why would we take that option away from parents? We're not going to do that. Come up with a different plan. We put other proposals on the table. We're willing to work with them. But the one thing that we will not do is we are not going to rob parents of their right and their obligation to tell us if they want testing or not of their children. It's not going to happen. It's morally wrong, it's repugnant to me personally, and it opens up this district for liability of untold proportions. We will not do that. We will work with them. We will get to a better place. Dr. Arwady will talk briefly about some of the things that we will put on the table, but we're not going to rob parents of knowledge and the ability to say yes or no as to whether or not they want their children tested. That's outrageous, and we're not going to agree to that. Period. Period. We're not going to rob parents again of their rights and their choice. Parents have to be at the center of this, as are their children. And we're going to make sure every single day that they are. CTU leadership, get to the bargaining table tomorrow morning, not in the afternoon, tomorrow morning. Bargain with us hard all day long in good faith. We will be there, ready to go, first thing in the morning. Don't tell us sometime in the afternoon. That's unacceptable. Children's lives are hanging in the balance. Our parents need predictability and stability in this system, which requires us to be adults, get to the bargaining table, and get a deal done. And we can't do that if we're playing games and not spending the time and the hard work that it takes to reach an agreement. Get to the table. We'll be there. We will be there. We will be there waiting. We will be there ready and good faith to engage in constructive dialogue. But don't tell me you're too busy and can't do it until the afternoon. Tell that to the parents who are trying to figure out and scramble for childcare, trying to figure out whether or not they're going to have to give up a job again. Tell that to the parents who have spent money to pay for tutors because their kids have suffered through learning loss. Tell that to the children who have suffered trauma and emotional pain because they've been isolated and torn away from their social networks. When you tell me you're too busy to be at the table all day long to get a deal done, you tell that to our parents and those kids who are suffering and depend upon us to do the right thing for them. We will. We're not abandoning our parents and our students ever, ever, ever. Dr. Arwady.
Thank you, Mayor. Excuse me. Good evening, everybody. First, I just want to start by saying there's a good chance if you're watching this, you're feeling really stressed right now about what is going on, particularly if you're a parent, if you're a student. All of us are stressed right now because we're in a COVID surge. And I want to acknowledge that this additional layer of uncertainty is making an already challenging month even more challenging. I'll be brief. I just have a few additional things to add. One question that I've been answering a fair bit today is, how exactly do you know schools are safe? What data do you have? Not just what the CDC says, not just a study I can read. Talk to me about what that investigation actually looks like. How do you have those answers? And I want to remind you that since the very earliest days of this pandemic, when the entire world was on fire and there were 17 areas that my team needed to focus on, we chose from the beginning to develop a youth settings team led by a pediatric infectious disease doctor, supported by dedicated epidemiologists, our school health team that historically is regularly in Chicago public schools, doing things like making sure children are getting dental care, getting eye care, getting access to treatment if they have other issues. Took the expertise that we already had in schools and said, we don't have the answers yet for what to do with COVID in schools, but these are going to be the biggest questions. And for almost 2 years now, that's what that team has been studying. I shared a lot of data last night. I shared data, for example, when we did a comparison in the first fall of the pandemic, was that the first fall? I'm forgetting now. The first fall of the pandemic. When
2020.
Thank you, October 2020. It's been a long 2 years. In that first fall of the pandemic, when Chicago Public Schools was remote, and virtually all other schools in Chicago chose to come back in person. We supported in-person learning at that time. It is the decision of individual schools and districts and done in conjunction with the state. And as I said last night, for those months, we collected all the data on who got COVID, who was teaching in the schools, who was attending the schools, who were teachers and students who were not attending the schools in person in CPS. And we found higher levels of infection in both children and staff who were learning remotely. And I know that seems a little counterintuitive. You can read the paper, we've shared it, it's part of the literature out there. But more recently, let's talk about this last semester, where we got through a Delta surge. And during that Delta surge, that same team of experts in child health, child infectious disease, keeping schools safe, that has been working not just with CPS, but with all of our schools around the ventilation measures, around what needs to happen for masking, around problem solving for distancing and cohorting, and yes, around testing, and I'll talk a little bit about that in just a minute. CPS has taken a particularly conservative approach to COVID mitigations. And I think that's appropriate. There's a lot of worry. So for example, you heard Mr. Martinez say there have been a lot of children quarantined. Do you know what the data is on the children who were quarantined? Remember who gets quarantined. Someone is quarantined if they are a close contact of someone who is known to have COVID-19. When we have cases in any school, any case where there have been close contacts, where kids had to take their masks off to eat lunch, where elementary schools are gathering and you didn't know who was distancing, where you're moving between classes, very conservative approach. That's why lots and lots and lots, thousands of kids are getting quarantined. What percentage of those children subsequently developed COVID or tested positive? What do you think? Depending on the week, between 1% and 3.4%. Meaning that depending on the week, between 96 and 99% of the children who were close contacts to the point that they were quarantined in school did not go on to develop COVID. That is because all of these mitigation measures are in place. We also, this team compares data. What is happening in CPS versus our non-CPS schools? We do daycares also. If we're seeing significant differences or changes, we investigate that. And we haven't. But our other school systems are open right now. Yes, are they having challenges? They're having huge challenges. We're all in a COVID surge. Are there individual schools that need to flip? If their numbers of staff or their numbers of students who are needing to be out for isolation or quarantine, yes. Do we support that? Of course we do. We're in full support of these metrics around closing a school. It's important that you can get the operational things that you need to be able to have appropriate instruction. The other one piece of data I want to share is about what have we seen related to spread in schools in Chicago. Let's just take this last, since we opened in the fall. Every time there are multiple cases identified in a school within a period that suggests there could be in-school transmission, the CPS team is consulting with the CDPH team, the people who day in and day out worry about outbreaks in schools, not new because of COVID. And we do an assessment. Can we rule out in-school transmission or can we not? If you have 2 students who are siblings, chances are a lot higher that the spread was at home. Do we have a student who is a known close contact in another setting where there's been known to be transmission? Yeah, that's more likely. If we cannot rule out in-school transmission, meaning that, yeah, there may have been transmission here, we count that every time. We call it a cluster or an outbreak, depending on the size. We did that starting this fall when there were 2 cases. Even if there was 1 student where we could not rule out transmission to 1 other student, or 1 teacher to 1 other teacher, or 1 student to teacher, we keep track of all of that. And in the hundreds of schools across all of the months, do you know how many of those clusters we saw? A little bit over 50. And the average size of those clusters or outbreaks was 2.5, meaning when we investigated, we were not seeing a student or a staff member in school spreading to 20 students. We were not seeing whole classrooms get COVID. We were not seeing whole grades get COVID. And so when we make these recommendations, we look to see, are we missing anything? Let's compare. What do the numbers look like in New York? What do they look like in LA? What do they look like in New Orleans? Are our positivities in the range we would expect? Are the amount of outbreaks or these clusters anything more than we would expect to be seeing? If we have a concern about a school where there is an outbreak or a cluster, my team is then in there with CPS saying, what happened here? What went wrong? Are you taking your masks off when you shouldn't be? Did you not adhere to a certain protocol? We act to prevent that from happening again. So can I guarantee that a child or a staff member would not get COVID in school? I can't. Is the chance high that they would? It absolutely is not. Where we see children and students and staff and really everybody in Chicago get COVID for the most part is when we let our guard down. Our case investigators and contact tracers have been investigating COVID cases for 2 years now. They have a lot of experience in understanding where we see patterns of disease, where likely spread was. Most of the time, it does tend to be at home, and that's not in any way, that's not about unsafe procedures at home. It's about that's where we let our guard down. And so, yes, there are studies, yes, there is data, but right here in Chicago, including right in Chicago public schools, we've seen nothing different with COVID than we have in the other schools that are open and in person right now. And nothing significantly different from what we've seen in other large school districts. There is definitely room for operational improvement. And my team today has been working very hard to support CPS in coming to a conclusion on this debate. We said, let's get the kid N95s. No problem, do it, spend it, I don't care what it costs. Do I think that a child needs a KN95? I do not. But if that makes people feel more comfortable, make them available, please. KN95s for everybody, as long as they want them. They're already available for staff, for whom I think it could make more sense. In the same way, I would like to see more testing. I am in agreement with the Chicago Teachers Union on that. And my team has been working with CPS to figure out how we should do that. We've been on the phone with everybody today, from the top of the federal chain to anybody who is selling authorized FDA tests across this country. We have to figure out the personnel to administer these tests. And my ask really around this is that we would be working with, for example, our school nurses in the schools. I would ask school nurses to be willing to be part of testing, of case investigation, of contact tracing in Chicago Public Schools. We can commit to getting more testing resources there. We've already got that well underway. We had testing results, PCR testing results, from that first day of school coming back in less than 24 hours. In a city right now that is doing more than 50,000 tests every day, 5 times what we were doing in our first pandemic, let me tell you, that is not easy to pull off. We are seeing turnaround times at many of our community sites of 4 days and 5 days, and we're also working on that. But the vendor that we're using for CPS put additional staffing on, getting additional resources in, saying, we've got to speed this up, we've got to build confidence. In the same way, I'd like to get rapid tests more available. I told you yesterday, does CDPH have any? We do not. Are we moving every rock right now to find some? We are. We'll get some. My worry is not, at this point, whether we have laboratory capacity. My worry is about whether we can work together, particularly with the school nurses, and make sure that they can play a leadership role in those schools for keeping them as safe as they can be, as safe as the data shows that we know that they are, but importantly, rebuilds that confidence. Because when we don't have confidence in our schools, what do we have? I'm really impressed by a lot of the work that CPS does every single day. There's a lot that you don't see behind the scenes. There are more resources needed. And I think partnering together with CTU around issues like making sure nurses are part of an expanded testing program is a really good step in the right direction. So I'm very hopeful that this will be resolved soon. I know there's progress. On the big things, there's agreement. Our role at CDPH is to continue to provide that data, to continue to provide the guidance that has gotten us this far and will continue to take us forward. I would ask parents who are sad and frustrated and trying to figure out work plans for tomorrow. I would ask kids who are disappointed about not having the opportunity to be in school again tomorrow to recognize that there's one thing that you can do today to help us resolve this situation. What is that?
Get vaccinated.
Make an appointment. If your child is not vaccinated yet, we all want to get back to school. There is agreement everywhere. More important than testing, than ventilation, than masking, than distancing, although these things are important and they are in place, is vaccination. The more we can have our schools vaccinated, the more everybody, parents, teachers, community members, can feel confident that these schools are even safer than they were before vaccine was available. I'm not going to go over the data again about how protective these vaccines are. They work, especially against severe illness for adults. And so we are seeing in schools with very high vaccination rates, very little concern about COVID-19. That's right. So what you can do today, if you are feeling frustrated, and I know you are, talk to somebody who isn't vaccinated. Make that appointment for a booster for someone who lives in your household. Do not be worried about something like, do not make the top priority something like whether my child can get a test in a moment if your child is not vaccinated. A test is a moment in time. It is important. We're very committed to doing more, and I think we should do more. We're supporting CPS in doing that. But to actually prevent infection, prevent severe disease, it is still about vaccine. So I'll end by saying that while we're working on a return of education, testing continues in Chicago Public Schools. 100 sites are open for testing tomorrow. They're on the website. We've not stopped any of that. Your kids can come in, get a test. Please do. I'd love them to. We're working on scaling things up. Vaccination sites are open. Not just in CPS and in the regional sites, but around the city. This weekend, CDPH is standing up another large mass vaccination clinic at our city colleges, as you know we've been doing on the weekends. Saturday and Sunday, we'll have pediatric vaccine, adult vaccines, boosters. CHI.gov/COVIDVax, or any questions or needs, 312-746-4835. We are the only large city in the U.S., perhaps the only city in the U.S., that will bring vaccine to your home free of charge, 7 days a week into the evening. Why do we do that? We want no barriers to vaccination. And we see some of the communities that are least vaccinated being the first to raise their hand for at-home vaccine. So we've transitioned a lot of our resources to double down on that. We were at 1,300 addresses just over this last week. That's a lot of individual sites. But we'll keep at it. Make that appointment today. Get your child vaccinated. Get yourself and your family vaccinated. That's what you can do to help us get this resolved. Behind the scenes, people are working hard, and my only wish is we get this sorted and we get back to school as soon as possible. Thank you.
We're happy to take your questions now.
Thanks.
Hold on,
Thanks a
sir.
lot, Mayor.
Hold on,
George,
sir.
we'll go
Hold
step
on,
by
sir.
step. Thank you. Thanks a lot, Mayor. Appreciate it. We're going to start off with Charlie DeMar from CBS 2, and please keep your mask on while asking your question. Thanks, guys.
And just identify who your question is for.
Mayor or CEO Martinez, is there any consideration right now of going to court seeking an emergency injunction to try and get the teachers back in the classroom as negotiations continue?
Well, as a litigator, I don't like to litigate in the press. But yes, we have taken some action in that direction, and we'll see what happens tomorrow. We'd rather resolve this at the bargaining table. That's the best. Hold on. That's the best thing. That's in the best interest, I think, of all concerned. Litigation is litigation. Where we should get this done is at the bargaining table. It doesn't make sense that we've been at this for 6 months and we don't have a deal. We need to stop CTU moving the goalpost, narrow the range of issues, and get a deal done.
Can you clarify where in the process you are with that litigation?
We are considering all of our options, and we'll make a determination shortly as to which levers we're going to pull, depending on whether or not we make significant progress at the bargaining table.
Has anything been filed?
a unfair labor practices complaint has been filed.
Aaron with Hyde Park Herald. Oh, sorry about that. For Dr. Arwady, please. So actually, I read the CDC's science brief on transmission of SARS-CoV-2 in K-12 schools again, and it says if community transmission is high and community vaccination is low, students are more likely to come to school while they're infectious. And then there's a whole section on screening testing in K-12 schools, which can be a prevention strategy, especially as children are asymptomatic. Does the lack of tests nationwide have any bearing on the city's opposition to universal testing? I was wondering also, about whether or not the lack of supply of testing to half the schools or the district students over winter break, but including all the students in Hyde Park, had any reason for this, just about for lack of it at all. But just given the lack of tests that are available, is that have any?
Just asked to. Why don't you let her answer?
Yes, ma'am. Sorry.
Okay, so I'll take the second one first, which is about the supply of tests.
Mm-hmm.
So you heard me say that I am moving and my team is moving every lever right now to get additional testing.
Right.
We're set on building lab capacity. We'll do that some more. We're working on getting rapid tests, even at a moment when that is extremely hard. And we will be looking to the CTU to agree that the school nurses should be part of any solution, of course, in schools like they are across the country, in terms of supporting testing, supporting case investigation, and contact tracing. It's critical that these professionals, who are more than 500 of them in schools, are part of the solution. And your first question?
Forget it. Can I talk to the mayor, actually?
He was going to play CDP or epidemiologist because he read a CDC study that he wanted to question you about. Go ahead, Aaron.
It wasn't as well read or written as I thought it was. I'm interested more so in your moral opposition to this. If we do
My moral opposition to
the universal testing that the CTU is proposing.
I don't have a moral opposition to testing. I don't know where. You've never. Hold on. You've never heard me say that out of my mouth. That's never the point. The question is, we have a nationwide shortage in testing. So we've got to use the scarce testing resources to go to the places where we know the challenges are the greatest, and then we build out from there.
But you said that you said that you didn't want to get in the way of parents, having an opt-out testing policy.
That's a different issue.
Sure, and that's what I was wondering if you could speak more about.
Here's my concern as a parent, but also as a mayor. Parents trust us with their children. They want to know exactly what is going on. They do not sign up for letting us do whatever we want with their children when they come into schools. And so if a parent wants their child tested, we'll get them tested. But they need to identify that for us affirmatively. We are not going to flip the switch and take from parents the ability to determine for their own self, for their own family, whether or not there's going to be testing. That's what the CTU wants, to say to parents, last and final call. If you don't tell us affirmatively that you object to testing, we're testing your 3-year-old, your 4-year-old, your 5-year-old. And in what world is that appropriate? That's my concern. Not only does that, I think, really have the potential to erode the trust that we are trying to steadily build every single day with our parents, the lawyer in me says that is a recipe for litigation disaster. We're not going to do that. We want to work with the parents to build a testing regime that makes sense, but we want them to consent for their child to be tested. That's the smart, moral, rational thing to do.
Several other reporters have pool questions that they've sent to me. Cassie Walker-Burke at Chalkbeat has a question for CEO Martinez, who she asks, can CEO Martinez say more about, quote, gradually building up, unquote, schools on Friday? Roughly how many schools does he think would actually have the staff to open if only 10% of staff reported today? What would kids be doing? Will they be in gym, et cetera?
No, so again, this came directly from our principals, asking us to not handcuff them, to allow them, especially when they have staff that are ready to receive children. And so what we're putting in place is that tomorrow, schools that have those resources, because tomorrow will be another day that, again, that I welcome all of our staff to come. All of our schools are open. And at those schools, to empower them, to allow them to call families directly and say, we're ready to receive you on Friday. It will vary because, again, we are dependent on how many staff show. And so what I'm empowering schools to do, and that is the range of everything from doing packets the parents can take home, to using virtual lesson plans, to, again, bringing in children safely in person, all the range, helping children with their college applications, and we're still navigating that process, scholarships, providing therapy services for our diverse learners. So we've always said this, it's important for the schools to be open, it's important to provide services, and what principals asked me today said, don't limit it to just non-academic services, please allow us to do more. And so that is what we're doing. That kicks off Friday. We will provide updates to families, but the schools will actually be in communication with parents on a regular basis. In the meantime, we need more of our staff to come into the building so we can provide more supports to families as they need us more than ever. And we need, frankly, the union to not discourage staff to come in to work and to support our families.
For Sarah Karp at WBEZ for CEO Martinez, all over the country and in the state, school districts are going remote because of staff shortages. I know you finally offered up a metric, but even principals say it is really confusing. At what point would you consider closing a school because of staff shortages?
So what we have said, and we've been doing it, again, Park Manor is an example that I use. By the time we got to the break, almost every classroom at Park Manor was remote except for one. And it is empowered at the principal level. What we have said also, and it was mainly driven, and again, always driven by cases. And so for us, what we did is we put a metric to say, look, once we get to a certain threshold, so for example, if 30% of our staff are being affected by COVID, they actually have to, where they have to quarantine, where they're actually positive, then we need to look at that in terms of how it impacts the school with the consideration of how many substitutes we can get there on a regular basis in a timely manner. As children cases are going up, and we see, for example, half the classrooms starting to go remote, that is a good indication for us that we need to be even more conservative to look at the entire school going remote. So that's what those metrics are saying. And so again, for me, the main thing is, and this is what I offered to the CTU. We work with you. We have a tactical team. You bring your team. You tell us what concerns you have. Let's work it out. Because then we can deploy resources to that school, whether it's testing, a vaccination event, whatever that is. We can be nimble because we're a large district, and when we're focused on a few schools, we can deploy a significant amount of resources. When we have to do a district-wide action, it's just not practical. Imagine the amount of energy and resources that it takes to try to take a district-wide action. It's just not practical.
I think Sarah has this for Dr. Arwady. If the school district was giving out saliva tests rather than nose swabs, do you think that opt-in consent would be needed, or would opt-out be enough because it would be less of a, quote, quasi-medical procedure?
So we do have some schools in the city that are using the saliva tests. As you know, each school is and district and system can set up its own decisions around testing, and we've been in support of that. What I am, again, the most interested in is actually building the ability to test many, many children, to build the confidence and rebuild the confidence for parents in these settings. One of the things we talked about today, and that again, I would hope there would be partnership between the district and the union on, is putting more resources into getting those consents signed with a particular focus in the schools that are the least vaccinated, where the concern is highest. I think there are a lot of creative things that could be done together on that. Thinking about what have the barriers been? Why have there not been very many consents signed? For me, that's an example of something that we can work on together that gives you more opportunity to be doing more testing in a way that is transparent and that people understand what's going on. We have been having additional conversations about what those numbers should look like. Again, looking to other cities. Because you looked at the CDC guidance, you'll see really the recommendation is to focus on unvaccinated people, which makes sense. The focus is also to make sure that you're doing a random sampling, typically 10% of students a week, 10% of unvaccinated students or staff a week. We've seen, for example, New York City working with its unions and its partners say, right now, let's get that up to 20%. It's not about testing every student every day. That is not a goal. That is not a recommendation that has a basis in anything that we've seen in terms of actually having more of an impact on preventing spread. Remember, first priority, anybody with symptoms, don't come to school and make sure they can get a test. Because if they were in school, we need to do additional investigation. So get additional resources there. You've got a concern, you've got multiple cases, I want more testing right away at those sites. What I don't want to do is test everybody every day in some of the schools where we've got 90% vaccination. That makes no sense. It's about prioritizing these resources, which are scarce right now, where they're most needed. When I make the commitment to say if we can get rapid tests, they're going to CPS, that is me making a decision right now that we might not have as many for the healthcare system. We might not have as many for our homeless shelters. I worry about that, but I worry more about the possibility of this stretching on and on and on and on. These are the kinds of hard decisions that we make, but personnel is the number one thing. And so for me, it's the details of the school metric, the details of the testing, that can all be sorted out. There's nobody taking a hardline stance on any of this. But some of the fundamentals around making sure we're working together on getting consent signed, making sure we're working together, again, on having nurses be part of COVID control in schools. That's what's happening all over the country. That's one of the biggest differences that we see when we compare what we're doing with some of the other large districts.
Eric, ABC7.
CEO Martinez, you mentioned there could be take-home packets, virtual lesson plans starting on Friday. I mean, that sounds like something that they would do at home. Can you expound on what the academic day will look like starting on Friday, some of the ideas that have been floated by the principals, aspirationally what you hope can actually realistically be done starting on Friday?
Yeah, I mean, so first of all, the most important thing to know is that we're not talking about a remote learning plan. Again, when we explore that district-wide for our principals, and they said to me, CEO, we care about children. We know that's where your heart is at. We can do it. But here's what it would take and the amount of time. And here's the uncertainty that we have with only, at this time, just having a small percentage of our staff that are even reporting into the buildings. And it's such a small time frame. Are we going to actually be able to give children the support that they deserve? And so, again, their request was, give us more flexibility. We're in different places across the city of where our staff are at, the comfort level that our families have. And so give us the flexibility, the wide range. So what I shared with you was examples, but to send the message that it's us working directly with our teachers and our principals to do what's right for families. And again, the only thing that holds us back is having more staff in the buildings. And that is the plea that I continue to do, because we have many staff that wanted to come in today, and I heard anecdotally in different ways that, they were discouraged not to.
But will there be any academic activity taking place on Friday within the buildings?
So the goal is for schools that have the staff is we would like to have academic activities on Friday. That is the goal. And of course, our goal is, the entire district having academic activities, again, if we can reach a deal.
Enrique, Univision.
Thank you, Cesar. My first question is for Superintendent Martinez, and I want to ask you again in Spanish, just like I did last night. El día de hoy en Noticias Univisión Chicago a las 5, usted nos dijo que se cancelaban las clases el resto de la semana para poder trabajar en el plan que usted ocupa. Ahora nos está diciendo que va a haber clases el viernes. Por favor, aclárenos para nuestros padres si va a haber clases o no el viernes y cómo va a lucir ese día. Y sobre todo, ¿para cuándo va a tener el plan listo para las próximas 2 semanas?
Sí, no, claro. Primero hay que aclarar, no hay clases mañana, el jueves. Lo que he dicho es que queremos poner un plan para nuestros padres para que puedan planear por el futuro, ¿verdad? Y lo que pidieron nuestros directores es que les diéramos la chance para, si tenemos los maestros en los salones, porque ahora nomás tuvimos el 10% de nuestros maestros en los salones, que las escuelas puedan dar más servicios académicamente, incluyendo niños de persona. Y lo que nos pidieron nosotros, que nosotros les demos el poder que ellos puedan contactar a las familias para decirles qué servicios pueden dar. Servicios, por ejemplo, paquetes que se pueden llevar a la casa, programas digitales y también hasta trayendo niños en los salones. I was clarifying earlier that I had said that we were trying to build a plan and that it was very possible that it would take us this week to build a plan. And what I'm clarifying is that classes are canceled for tomorrow because, again, we still have uncertainty about the number of staff that will be in our buildings. But with that, on Friday, what principals asked of me was to allow them to provide additional academic supports to children, including in-person instruction, but to empower them based on the staff that were showing up, because my principals are in direct communication with their staff on a regular basis. And so for us, and again, with that, again, this is while we're still working to get a deal, because our plan is still, we want our children to be in person all. Para nosotros, el gol no ha cambiado, la meta no ha cambiado. Queremos todos nuestros niños que regresen a nuestros salones lo pronto es posible, pero tenemos que negociar con la CTU.
Pero entonces, ¿cómo va a lucir el plan el viernes, sabiendo que posiblemente no va a haber un acuerdo de aquí entonces? ¿Y cómo va a ser el día escolar?
Lo siento para nuestros padres, ¿verdad? Por eso me da mucha tristeza, porque para que nuestros padres estén en esta situación, para mí es muy triste. No es algo que debería pasar, ¿verdad? Y tenemos que pensar en eso. ¿Cómo pasó eso? ¿Cómo podemos dejar que esto puede pasar en esta ciudad tan grande? I said, the question is, how can our parents then try to navigate Friday with all that uncertainty? And I am so sad for our families. They should not be in this position. In a city this large, this should not happen. The way it happened, it should not happen. And so again, we are going to be there to support our families, pero tenemos que trabajar con ellos porque ahorita tenemos que negociar con el CTU y tenemos que regresar a nuestros maestros a los salones. And we need to negotiate with the CTU and bring our teachers back into the rooms to provide more services.
Pero si hay clases el viernes.
Van a empezar servicios el viernes, y si lo que puedan hacer las escuelas, se van a contactar los directores y maestros con los padres directamente. So the services, again, we're going to encourage services on Friday. The schools will reach out to families based on what they can provide for Friday.
Joel Hillary, WGN.
So my first question is, there's been a lot of talk about schools being the safest place for children. I mean, would you say that's the same for the adults in the buildings as well?
So where we've looked at data here in Chicago, as well as across the country around the world, we have seen similar or lower rates of COVID when in-school education is happening for staff. The data that I gave previously related to positive testing after quarantine, number of outbreaks, that also includes staff. The majority of the clusters outbreaks, these approximately 50 over the many schools, 64% of them only included students. We typically, most often, we see them either students or staff. Rarely we see potential transmission between student and staff. But yes, I, of course, would not be recommending this if I thought that teachers and other staff were at severe risk. I'm also reassured by the very high vaccination rate. I would encourage any teacher who is concerned, if you haven't gotten your booster yet, get it. That's another layer, and we're seeing every day so clearly in the data, people who are fully vaccinated and boosted in this city are the ones who are weathering this well.
And then I have a question for the mayor as well. Earlier today, some of the union leaders, they had some concern over federal money that they said that they were saying was not being utilized, but I just wanted to get your response to that.
Not true.
She mentioned like $2 billion in federal funds.
$2 billion of federal monies that's not being utilized? No, not true. I mean, give me a break. $2 billion, think about that. $2 billion that we're sitting on a stack and we're not utilizing it to help and benefit our residents? Does that even make logical sense to you? I mean, I would just say, I don't think you've been to our press conferences before. When you hear something like that, doesn't red flags go off in your mind? And you need to ask them, what's the proof of that? Mm-hmm. Because so often through these interactions with CTU leadership, they just say things. that are untethered from the reality. Think about the fact that we'd have $2 billion of resources available to help our residents on a range of things in a time of a pandemic, and we wouldn't use that? That's crazy. That's just not true.
Sophia, Sun Times.
Thank you. This is for the mayor or CEO Martinez. Are there any state or federal laws you all are referencing that specifically prevent the city from mandating either the negative COVID testing or preventing or implementing an opt-in testing? Is there an administrative policy that stance is being based upon, or if you could elaborate more on that?
It's called we don't take from parents the right to tell us what they want to do with their children, particularly when we're talking about a quasi-medical procedure.
Okay.
It's kind of basic common sense. It's basic decency. The fact of the matter is that if we did something that then the parents connected to some adverse reaction to a child, imagine the liability that we would be opening up ourselves to.
Got it. So then just no state or federal laws in place that you all are specifically looking to in that?
It's called, we're not going to expose the district to potential liability for some harm that might be done that a parent might later allege is connected with some unauthorized quasi-medical procedure. So I'm sure I can come up with a bunch of tort actions, but it's basic common sense. Parents have the right to tell us when they want their children to be subject to some kind of testing. And we are not robbing them of that right. We want to work collaboratively with our parents so that everybody is in one accord when it comes to the work that must be done to get students safe but the biggest thing is, let's get them vaccinated. And the parents are there. We want students vaccinated. We want the parents and the whole family to be vaccinated. But no, we are not going to launch off on some venture where we dictate to parents that we know better than they do about whether or not their kids should get tested. Where's the slippery slope there? And then what we're going to do, be vaccinating them without the parents' consent? Do you think that's a good idea? Yeah.
Jorge de Santiago, Telemundo.
Para el señor Martínez. Entonces, para recapitular, ¿qué es lo que deben de saber los padres de familia esta noche cuando se vayan a dormir? ¿Qué es lo que va a pasar de aquí en los siguientes días?
Sí, lo más importante que sepan los padres que no vamos a tener clases mañana, que vamos el viernes para las escuelas que tengan suficiente maestros, otro personal, que vamos a dar servicios, incluyendo pudiendo dar hasta clases en persona, pero no sabemos ahorita cuántos maestros van a regresar. Ahora nomás regresaron 10% de nuestros maestros y la Unión no los está apoyando para que regresen. Lo que yo quiero es que tener un tracto que estar de acuerdo, un acuerdo con el CTU para que podamos regresar todos nuestros niños en persona lo más pronto posible, pero ahorita no sabemos lo que puede pasar el viernes, pero quiero dejar las escuelas, darles el poder para hacer eso. Again, to clarify, tomorrow classes will be canceled. Starting Friday, we're empowering principals to be able to provide services, including academic services, including in-person instruction, as long as we have the staff in the buildings. And again, as a reminder, in order for our staff to be compensated, they have to work from the buildings. If you're not in the buildings, you will not be compensated. We're asking again, right now our families need us the most.
Esa última parte la puedes repetir en español, que la parte del compensamiento y todo eso.
Sí, es muy importante porque lo que estamos pidiendo a nuestros maestros, porque por favor regresen a los salones para ayudar a nuestros padres, porque ahorita es el tiempo que nos necesitan lo más, ¿verdad? Y para los maestros o personal que no regresen en persona a nuestros salones, no van a estar pagados por esos días. Entonces, para mí, lo más importante ahorita es que regresen nuestros maestros, que trabajen con nosotros para tener un plan donde podemos regresar niños más seguros y también para ayudar a nuestros padres que nos necesitan ahorita. Again, the priority right now is for our staff to come back into our classrooms to support our families when they need us the most.
That's a wrap, everyone. Thank you very much.
Thank you.